right, welcome back everybody. It's Wednesday, October 12th. We have been noticeably absent from doing videos because, quite frankly, we meet each week and decide there's not a lot of news to share. But we're looking at winter coming at us and looking forward. There's some things we want to start talking about. So we're going to hit some of those topics today. So as we always start, our first slide talks about the COVID rates via the Sutter Lab and the Bay Medical Foundation. Again, this probably underestimates the absolute value because of home testing. But the interesting thing is that we've plateaued, Gary, and we haven't come down as low as we had between previous peaks. I was a little disappointed to see this sharp descent, and then it's kind of been steady for over a week.
Yeah, I think that's a phenomenon of a lot of public health measures. You know, people are not wearing masks, kids are back at school, and these are symptomatic enough to come see your doctor, as opposed to I did a home antigen test because I had a cold.
Yeah.
So I think that's remarkable. We know that in the US right now, there's like 73% transmission. I mean, it is such a wildfire in the outpatient community, especially in crowded sessions like schools. You know, my daughter got it at college.
Yeah. You know, there's been some conflicting information coming out from CDC about masking, particularly masking for health professionals in healthcare settings. And I think the state of California ruled on that, and the ruling is...
Yeah, so the ruling is masks are required in healthcare settings, period. And I'm glad that that hasn't changed. The CDC, just about a week or so ago, came out with a statement in the middle of the night. They changed their webpage, and it talked about perhaps reducing mask using in healthcare settings if your numbers are really low and if you're in non-clinical settings. But the language was confusing. So the California Department of Public Health, CDPH, quickly came out with a statement that says masks are required in healthcare settings, whether you're vaccinated or not. And I really support that. So we're still wearing masks indoors, and we're still wearing masks in healthcare settings. Very appropriate.
So nothing's changed. That's
right.
The bottom line.
That's right.
So Gary, we're looking at this. It's kind of this plateau. Winter's coming. Do the experts predict a bump this winter?
So this is like Game of Thrones, right? Winter's coming.
Winter's coming. Yeah.
So I want to show a couple slides and let you know that I think that it could be a rocky winter for a lot of respiratory viruses. I'm going to show you some data. The next slide is showing you data from the world, and it shows you kind of what's going on in Europe. So right now in Europe, if you look at cases per million, so this takes into account population density, Germany and Italy are on the rise. So Germany and Italy are seeing a rise of cases. It's still the Omicron subvariant, so there isn't a new variant out there. We've seen the Alpha, we've seen the Delta, we're in the Omicron stage right now. We haven't seen a new surprising variant come up, but the Omicron variant continues to mutate within itself, and so we're seeing subvariants and sub-subvariants come out of that, and Italy is having some subvariants. The subvariants might be escaping monoclonal antibody, but vaccine is still very good. Okay. So vaccine works for all the Omicron subvariants as well. Germany, Italy are here. The United States is running third. Even though our rates are going down, our prevalence is really high. And that speaks to this incredible outpatient. So those are cases. The real question is, what about hospitalizations? And the next slide is going to show that. The next slide is going to talk about who's seeing a bump tick in hospitalizations. And what's interesting about this slide, if you move to the far right, our rates are going down for hospitalization, but we're still have the #1 hospitalization cases in the world. And so right now in the US, I actually have this data, about 400 patients are dying a day of COVID. In California, that's 20 to 30 patients are dying a day of COVID. And hospitalization rates in the US are still in the thousands. So even though our rates are going down, we have the #1 hospitalization rate for COVID in the world. France and the United Kingdom, Italy, Canada, Spain, Belgium, their hospitalization rates are starting to go up. So what does this mean for the winter season? I think we're going to see a rise in Omicron hospitalizations. Whether that's a surge or not is going to depend on how well we vaccinate. And so that's going to be a very important strategy. But I think what's going to happen is I think we're going to see a layering of COVID this winter and a layering of the flu and also other respiratory viruses. So
Makes sense.
I want to pause there because we always show you guys a lot of graphs and I don't want to overload your brain. So this is just kind of fun, but it's also kind of a clinical pearl. What's the most common symptom of COVID? So the old answer is loss of taste and loss of smell. We saw that very early on in the pandemic, where that was really predictive. If you're in the office and someone said, "Doc, I have a cold, I have a fever, and I can't smell or taste anything," you knew that was COVID. But we're not seeing that with the Omicron variant. The Omicron variant doesn't seem to have that loss of smell and taste as prominently. The new answer is sore throat. Sore throat, severe enough that as a clinician you're thinking, do I need to do a strep test? But then you look in the back of the throat and there are no exudates, there's no blisters, there's no petechiae. So the new answer is the most common symptom of COVID is going to be sore throat. So think about that this winter season. Someone comes in with a head cold and a terrible throat, sore throat, and it gets worse for a couple days. That's more predictive of COVID. So that's just a little bit of a pearl as people think about the season. The next slide is a little bit more data. I've showed this before, but I want to explain it. Region 9 in the CDC is Arizona, California, Hawaii, Nevada, and then some of the islands in the Pacific. And so each of these bars represents a week. The oldest bars are on the left, the most recent bars are on the right. So these are a breakdown of the subvariants of what's being tested in the US in Region 9. If you look on the far left there, the bar shows that teal bar, the large teal bar, is BA5. BA4 is the light teal above it, and then the orange one is BA2, a BA2 subvariant. As you can see over time, when you move to the far right, BA5 has become the predominant, 88% of the strains, and BA4 has kind of gone away, and BA2 has gone down even smaller. So in the US, 88% or more of our strains circulating is a BA5 strain, which is covered by the monoclonal antibody, and it's also covered by the booster. So the booster really effectively covers that virus. But in Europe, India, Singapore, their rise is BA2. So a subset of BA2, BA2.75.2 is rising. There's also a BA4 subvariant that might get around the monoclonal antibody, but it does not get around the vaccine.
So the take-home message is that while we might see a bump, we still feel that it's going to be the standard virus, no big upcoming variants for the US at this time, and our vaccine should cover it.
Right. Yeah, the only thing that's changing is it's going to be colder, we're coming indoors, and some people are not getting the booster vaccine. Yeah. So right now in the US, I think 4% of eligible people have received a bivalent booster, and so that makes us very vulnerable in the winter season as we all start traveling more, holidays, but there's nothing new on the virus side of things.
Good.
So the other question is, what about the flu? And I think we're going to see a flu season this year, and I kind of wanted to show this data. This is data from the United States showing influenza rates for testing. About 2.5% of the tests are positive now in the US, and I show this to the far right. The yellow bar represents influenza A, and the green, the little tiny green thing at the top, is influenza B. So most of it's influenza A, and most of it is H3N2, like 99% of the influenza A is H3N2. That's the same strain that was in Australia just this recent season. So we predicted that if Australia had a rough season, we might, and I think this is kind of going along with that. It's the same strain that's seeming to rise early on in the US. And so I think, should we brace for a severe flu season? I don't think we should brace for it. We should prepare for a moderate influenza season. And it's going to depend, again, on vaccination rates.
So this was the Australia strain, so we planned for that. This matches our vaccination.
That's a good point. Yes, this strain does match the vaccine very well. Okay. You know, so the next slide is kind of an interesting slide. This is how I think about influenza virulence. Pediatric mortality, I think, really tells you how virulent a strain is that's circulating. And this is a slide showing 4 different flu seasons, 18 to 19, 19 to 20, and if you look at 2021, and I'll put a big circle there, 2021 is when the pandemic hit, we locked down everything, and we didn't see any pediatric deaths except for 1. But look at 21-22, I'll put another red circle on that one. 21-22, which is kind of where we are now. We had that weird summer flu bump with some pediatric mortality, and we're still seeing a little bit of that today. So I think we're going to see a flu season because it's not just circulating flu, that's a lot of outpatient diseases. It may be typical of what we've seen in flu seasons in the past. So layer that on to Omicron. So I tried to look in California. The next slide is I tried to look in California at CDPH. They don't have any data yet that they're showing publicly. So I went to UCSF. This is a slide from UCSF that shows you, and I think it's a good surrogate for what the Bay Area is going to look like for influenza strains. I'm going to walk you through this. I'm going to put a little red star to the far left on that blue bar, and that's influenza A. But let's follow that. I'm going to kind of draw a red line to kind of show you the incidence of influenza A. And as you can see, that red dotted line, there's a little bit of influenza A.
This is over what time frame?
These are weeks. So
Weeks.
each of these peaks are weeks. That's a good point.
Okay.
And the big brown ones that you see there, that's rhinovirus. We always have rhinovirus around. And each bar represents a different viral strain. And so from left to right is oldest to most recent. And as you can see, the influenza A red dotted line remains very low. So there's a little bit of flu out there right now, but it's at very low levels. What's interesting about this, and this has got the attention of the health department, is that I'm going to put another blue star to the left, and that's RSV. So that light blue bar represents RSV. Now let's follow RSV to the right. And as you can see, this black dotted line shows that RSV is on the rise. And in other flu seasons, RSV predates influenza. It kind of goes before it. And so we might be seeing the typical RSV rise before we see an influenza rise. And at the very last part, I want to put a star to the very, very far right. And that's a teal bar, and that represents parainfluenza. Right now in the US, there's more RSV. Well, in California, there's more RSV than there is flu. There's more parainfluenza than it's going to be flu. So what I think that means for the winter season is it's going to be a smorgasbord of respiratory viruses. Yeah. We're going to see RSV, we're going to see parainfluenza, we're going to see influenza, we're going to have Omicron. So my thought is, remember, abrupt fevers and chills, horrible headache, that's the flu. If you have someone that gets a bad cold with a really bad sore throat, that could be COVID. But anything's possible with other respiratory viruses. A lot of rhinovirus, a lot of adenovirus. It's going to be a bit of a mix this season.
All right, what's this, Gary? You got something new?
So I want to present a new topic. So we've decided to present something called In the News. This is going to be kind of a new part of the video that we have with you guys. In the News means things that your patients might be asking you in the news, but it's not really relevant to us today here. So before we talked about polio in New York, it's kind of burned out. So that was kind of an in the news thing. Nothing for you to do, no changes in California, no polio in California, but it's in the news, your patient might be asking you. So there's another topic in the news I just want to put out there, and there's really nothing for you to do, but I think you might want to know about it from a health standpoint. On the box to the right, October 6th, the CDC sent out a health advisory that there's another outbreak of Ebola virus in Uganda. It's a Sudan Ebola virus strain, which is as bad as Zaire strain. So the Zaire was a really bad one that happened in 2013 to 2016. And the Sudan Ebola virus, they've seen it in Uganda before. The first case was in September 20th. It's been in the Mubende district, and that's in the central part of Uganda. So far as of last night, 54 cases, 19 fatalities. 4 fatalities were in healthcare workers. The latest death came out of the Mubende district as someone fled an Ebola virus facility and they went to the capital city and they passed away. There's been no cases outside of Uganda. There's been no cases in the United States, but the CDC sent out a health advisory. Not a health alert, but lower than a health alert, just a health advisory. There are 2 vaccines that are being used for Zaire Ebola virus, and we don't know if those 2 vaccines are going to be effective for the Sudan strain. So there's a lot of chatter about whether that'll be effective enough. And then, now I'm going to put in the map. This is the map of Ebola virus, and I put an arrow there to show you where Uganda is. And this just shows you where the other strains have showed up. This is ever since 1976, how many outbreaks there have been for Ebola virus. But this is in the news. In other words, not really much for you to do, nothing to worry about, but your patients might be asking you about
That's
that.
just dinner conversation.
Yeah, but just in case patients are asking you. So we've kind of presented a lot of information. Let's just go over a couple summary points.
Sure.
One is COVID hospitalizations are starting to rise in Europe, India, and Singapore. But in the US, BA.5 is still the predominant strain, and the vaccine covers it really well.
You know, and this is where I would comment. So what are we to do with that information? The vaccine remains our defense. When we know that the vaccine seems to be appropriate for this, we have the bivalent vaccine, and that's what we should be doing. You know, you see various descriptions and scenarios where they say if the patient is fully vaccinated, I've now discovered that fully vaccinated means that your patient has had the bivalent vaccine. So that's safe to say that 96% of Americans are not fully vaccinated right now because only 4% have had the bivalent. So keep that in mind. And then for us as clinicians and staff, we have the bivalent vaccine here available, but because of the process, because it has to be kept at that cold storage level, it cannot be transported around to our clinics. It can't be delivered in a lot of different sites. So the one caveat to get the bivalent is it's only be given in our clinic in airway room 310, and they will accept drop-ins. So if you want to get two things, you want to get your flu shot and your bivalent COVID vaccine, you can drop in or make an appointment at our vaccine clinics in 310. That's important for us to do that because they're not going to come to you with the bivalent because of that restriction. So keep that in mind.
And I think the public health department is going to mandate the flu vaccine for healthcare workers.
They always do,
and
don't
it
they?
may strongly recommend and or mandate the bivalent booster as well.
Okay.
So important. Very little influenza activity in the US and in California. However, H3N2 remains the predominant strain, and that's very similar to the recent Australia season. And it's a good match this year. The vaccine is a good match. And RSV is on the rise, and there's even more parainfluenza than flu right now. So we're going to see a mixed viral season, I think. And then just in the news, there is an Ebola outbreak of Sudan strain in Uganda. The CDC set on a health alert, but nothing in the United States.
Okay. Well, thanks, Gary. That's a good update. I hope you find that helpful. The news is keep your mask on and keep washing your hands and be prepared. We should be thinking about what we need to do this winter. We've been through this before, and so we'll be working out our workflows in advance, I hope, so that we can minimize the excess labor that's involved of us, the caretakers for our community. So,
Yeah, thanks very much.
thanks for listening. Bye-bye.